So what are wound care products? Wound care products are medicinal items that helps protect wounds and make them heal faster. They work by keeping the wound clean, moist, and safe from infection. This is very important because a clean and protected wound heal better and faster. Wound care product comes in many forms. These include dressing, bandage, ointment, aseptic, and even advanced healing material. In simple terms, wound care products are things we use to help wound heal properly. They protect the skin, prevent infection, and support the body natural healing process. Now let's talk about type of dosage form. Main categories are hydrocolloid, silicone, transparent, oleaginous, antibiotic and antifungal, collagen, composite dressing, contact layer form, negative pressure wound therapy, wound negative pressure, hydrogen, hydrocolloid indication.
Now let us talk about important should be considered factor related to patients in aspect and synopsis. First point is age. The rate of metabolism of drug vary between baby and adult are different. Therefore, you need to vary the dose according to the age of the person. The next point is the body. Body surface area mg or m2 or the body weight mg or kg are most commonly used when calculating dose, hence mind your figure. The third one is a gender. The difference of the hormone may influence the distributions, metabolism and absorptions of the drug and is not the same to all persons and to all people. Let's talk about drug use and variable aspect and synopsis. There are 2 points here. The first point are strength and concentrations of the drug. Those leviate will have a stronger drug, thus you have used a few pills to achieve the same effects. That means when someone using a higher dose, a person need the same higher dose to achieve the same effect. Second, administration route. The way that you take drug, swallow, IV, IM, or topical has effect how fast and how much of the drug actually reach the bloodstream. Last point we want to talk about is management and synopsis, observations and analysis, with including aspect and synopsis. It's about dose computation accuracy. Double-check your arithmetic, at least in the case of IV or children. One include error which spoil entire pharmacokinetic discussion. With precision and measurement, utility calibrations equipment, syringe dropper, and measuring hub follow the same procedure that employed in process sample in the laboratory.
Active ingredient. First, silver sulfadiazine, a topical sulfonamide antibiotic that acts on the bacterial cell wall and cell membrane. Its function to prevent and treat wound infection in patients with second and third degree burns. Second, povidone iodine, a broad spectrum antiseptic used in first aid for minor cuts, burns, abscession, and blister. Its function to killing or preventing the growth of bacteria on the skin. Third, zinc oxide, Zinc oxide provides prolonged supply of zinc to wounds and enhance healing ability. Its function to providing a prolonged release of zinc to the wound bed, protecting against infection and creating a moist environment conducive to healing. Inactive ingredient. First, mineral oil. Mineral oil or paraffin oil is a mixture of higher alkanes from a mineral source such as petroleum. Its function to provide smooth texture and prevent dryness. Second, polypropylene glycol. Propylene glycol is a humectant that hydrates the wound. Its function to moisturize retention and enhance delivery. Third, EDTA. It used as a chelating agent that bind to calcium and prevent joining of cadrins between cells. Its function to prevent oxidation and improve product stability.
Next, what's the product are available in the current market? Specific product application method. Product a type. Gauzy. Example use care for general use or small cut. Place on the wound, change daily. Second, antibiotic ointment or petroleum jelly for minor cut, apply thin layer. Hydrocolloid for burn, blister or light exudate. Hydrogel for dry wound, apply gel or sheet cover with secondary dressing. Alginate for heavy draining or bleeding. Foam is for the moderate to heavy exudate. Transparent film for clean and dry wound. I will explain the way to use each product. The basic wound care step have a 6 step. First, wash hand. Clean your hand with soap and water before touching the wound. Second, bleeding. Apply gentle pressure with clean gauzy or cloth until bleeding stops. Clean wound. Rinse with clean or sterile water, saline, about alcohol or hydrogen peroxide. Fourth, apply ointment. Use a thin layer of petroleum jelly or antibiotic ointment to keep the wound moist. Fifth, cover wound. Choose a subtle dressing to protect and aid healing. Lastly, chain dressing. Replace with dirty, wet or as advised to keep the wound clean and moist for faster healing.
Now let's talk about new drug discovery and technology. Traditional dressing are affordable but limited. At one option including electroplasm dressing, hydrogel sponge, and nano and microparticle that release drugs slowly, fight bacteria, and promote faster healing. The latest technology even include smart dressing with sensory, portable negative pressure device, biological skin substitute, and growth factor therapies.
So, in conclusion, wound care products are just not bandages. They are scientific tools designed to protect, heal, and restore the skin efficiently.